Right, good morning, everybody. For those of you that are new, just a few housekeeping things. I'm your host, Jenny Milne. I'm the founder of SRITC. We've got Iriana and we've got Nikki in the background today helping to support the cafe. Just a few bits and pieces, as you'll see with my coffee cup that's sitting there. Please mute at the beginning while I'm speaking and then Stevie, but your chat box is your friend, okay? Please introduce yourself if you're not used to this chat box at a cafe. It's cracking. It's loads of spiritually happy people on a Friday, particularly when the sun's shining all over Europe. Use the chat box, put your bits and pieces in there, say who you are. If you can, just put your postcode in if you haven't already given it to us, because that just helps us plot where everybody is in the community, which is really helpful. And it's all about thinking positively. And there might be the odd glimmer of challenges presented today, as I'm sure it always happens in rural transport, but we always end up going away happy. And I have to report, I don't have cake today, I'm afraid. It's been one of those weeks I've only got a biscuit. So who's going to, I've got a feeling it's going to be Rennie, because she always does. Oh, Sarah's got Jammy Dodgers. Yep, she's on it. Who else has got anything with them? Yes, we've got some more chocolate appearing. Anybody else? Rabina, have you got anything? I can't see Rennie if she's there, but she's usually my go-to, somebody who's been cooking something. No, is she not there? Anybody see her? Well, we've all got our coffees anyway, and I will eat my biscuit later on. So, oh, there she is. Rennie's been coming in. I've been changing this up slightly. Instead of me telling you how SRITC works and what it means, I've been picking on people to ask them what they think SRITC means to them. So I am going to pick on somebody different this week because I've not done it for a while. And she's not been here for a while, and I like her new haircut. Suzanne, good morning. I'm going to ask you what SRITC means to you, what it brings to you, and why you're coming to cafes.
Hello, Jenny. What it means to me, it's a great place for just hearing new and different things. So it's got that very broad outlook on the world, but also that granular information, because people know their own things so well and so in depth. So I think it does, takes very, very big sort of global perspective, but also gives you really detailed information. So that's what I love it for. And what was the other question?
That's fine. That's fine.
That's it.
I'm glad to see you smiling today. I'm glad to see you smiling. I'm also going to ask Ron, who is here with us. Ron, what does SRITC, because you've only been doing a few cafes, but what does it mean to you to be coming along on a Friday? If you want to unmute yourself and introduce yourself as well. Ron, you're muted. You need to unmute. Find the button. There you go.
Hi, I'm Ron Coleman. I live on the Isle of Lewis in the Outer Hebrides, and it gives me a place where I can vent, firstly, but secondly, also gives me a place where I can hear practical ideas about what we might do.
Fantastic. I'm hoping in due course, Ron's shared with me a fantastic video that they've put together about human rights and rural transport. So at some point, Ron, when that's publicly available, let me know and we will share it around the community. It's a really good video. So thank you for sharing, and thank you to Suzanne. So that summarizes what I've put on the screen, and it is about being a collective voice, bringing people together. And we're from quite literally all over Scotland, the UK, and as you can see from Europe today as well. And it's just a joy to be able to have cafe with like-minded people. So welcome and good morning. What you probably don't know is, to answer that question, how does SRITC work? We've got the cafes. As you know, if you haven't already got it in your diary, you will have it shortly. We have an online gathering taking place in early June. We're also available to be commissioned to be involved in stakeholder engagement, and we've done a few pieces of work recently, some of which we'll be sharing with you later in the year. And we also help various events provide transport, so we can help support rural locations as well. And something that I'll be talking more about in due course and at the online gathering is the role of social value and how we can actually measure it, and how SRITC can help you do that. Because social value is the big bit, that how do we prove that something's of value rather than it just being of economic value in a rural area. So there's lots going on within SRITC. including who's involved. And many of you will recognise this slide and will recognise either yourself or somebody else there, but that's the directors, it's the volunteers, aka musketeers, and advisory boards, some of whom are all here today. And I thank them very much for their time, because it's all voluntary time. So a quick few news bits from me, and one other person called John Carr is going to ask a quick question as well. So in your inbox, you should have got earlier this week our RIMP2 documentation, which is the international piece. Please have a look at that one, and or the first one if you haven't done so, and email me back. It'd be great to have the input by the 11th of March. It's not really a huge milestone that I can move, because we have to have the full project completed by the end of March due to funding criteria. So please drop us an email with any thoughts, good, bad, or you just like, you know what, it's great. Don't have anything to say, that's all we need to know. If it also hasn't landed in your inbox, the Scottish Government have launched a survey on their rural delivery plan that many of you will have heard me talk about. Now, the deadline is the 17th of March. I'll put this link in the chat later on. If you can circulate it around your networks and your communities, and also fill it in yourself, that would be really helpful, because it's not just about transport, it's about housing, it's education, it's everything to do with rural living, okay? So please take the time to do that. Also like to share that we're starting to work together with some local action groups and CLLD on social value. So if you're involved in a local action group or have one in your area that would like to be involved in understanding how we can measure and look at projects to do with social value, then again, let us know. As I said, we're looking at funding and partnership opportunities for going forward, and that also includes for the online gathering, which the girls will put in the chat is a bit, I hope, available to book free online now. So instead of having just to save the date, you should be able to just book in and get your place slotted. So it's 10 to 12 on the Tuesday, and it's Thursday 2 till 4, and that's to accommodate people on different time zones. So before I go to Stevie, I'm just going to stop my slide for 1 minute. I'm going to ask John Carr just to quickly share one question that he's got for the audience. John. Unmute. Unmute.
Yeah.
Yep.
I was recently in Devon, where they've got quite a number of community pubs and shops that have been established under the Localism Act 2011. And it occurred to me, if you can declare a pub as being an asset of community value, shouldn't your local transport lifeline, whatever form it is, be capable of being declared an asset of community value as well? I think it ties up very much with what Jenny's saying about social value, because community value, social value, I think there's really nothing other than a semantic difference between them. But essentially, I wondered whether the Localism Act has been used for anything in Scotland, as well as pubs and shops. I'm aware of at least one community health centre where they've managed to get an agreement that doctors and nurses will come in to a point in the community, to a village, in fact, and run a surgery a couple of days a week. And these are the sorts of things that I think emphasize that social value is as much as economic value, something that should be taken into account. We should be looking across boundaries as well, because what you develop maybe as a transport hub and the transport services using it can be built on to reinforce remote communities. And as I say, it's really a case of what would happen if you lost your transport service.
So John's going to put the details of what he's talking about in the chat, but I wanted to verbalise it for you. So if anybody's used this particular act in the UK in any guise, can you let John know? But now we're going to swiftly, I'm going to embarrass Stevie a bit, okay? I'm going to go back to what Stevie like. And this is what's available online, and I have known him for a while, and obviously what he looks like now. So I don't know how old that picture is on the left, Stevie. You might not want to embarrass yourself, but you've got the same haircut as my husband as well. It's easy to maintain, isn't it? Anyway, Thank you very much, Stevie, for coming along today. He's going to share his insights from the Department for Transport, rural projects that are going on, that he'll give you just a quick two-liner about how that's all come to be. And if I'm correct, I think I am, you're the only Scottish project involved in that DFT funding stream, aren't you?
That's right, yeah.
Yeah, so I'm going to hand the floor over to Stevie, and he's going to share some slides and introduce what they've been doing within this DFT funding stream. Stevie.
Brilliant. Thank you very much, Jenny, and thank you for that introduction. I think it's maybe 11 years old, that first picture now, so that is quite a while ago to be still claiming that. Great, thank you. Hopefully you can see that okay, Jenny?
Yep.
Yeah,
good.
Brilliant. Okay, so thanks. So firstly, I want to give a quick introduction to myself in terms of rurality. So I grew up in rural Argyll and Bute, and in a little village, and to this day my mum and dad, who still live in the same house, still don't have mains water supply. So there is, I've got that rurality now. I live outside Glasgow now, so I'm feeling a little bit like a fraud in these guises, but I do have that experience from growing up and obviously going back and seeing my parents regularly. So they are living in a situation where they're kind of isolated. If it's really cold in the winter, they might lose their water supply. And I remember getting on the post bus if I wanted to do absolutely anything else apart from stay in the village for the weekend. So I do come from that background, but the project that we've been working on, funded by DFT, coordinated by the Connected Places Catapult, is, as Jenny said, kind of looking at rurality. And specifically our project has been looking at the integration of healthcare and transportation. And we focused on the Fife region. So I'm going to go into that. I'll do a very quick intro on us as a company. Like, effectively, we are a company that takes data, unlocks it, and builds solutions for good, sometimes using AI, sometimes not. If you're familiar with the Cycling Scotland open data portal, that's something that we've built with Cycling Scotland over the last 5-6 years. So it is a fantastic national asset where all cycling and walking data from all local authorities across Scotland is available publicly and openly for anybody to use. So if you haven't already seen it, if you look for the Cycling Scotland open data portal, you'll see an example of kind of what we do as a business. And we are cross-sector as well, so it's not just for us transport, it really is across the board. Another example is we're working with the Ministry of Housing, Communities and Local Government, looking at the cladding on buildings and using AI to look at images effectively to try and identify the risk of cladding being risky, ACM and other types of at-risk cladding. So it's across the board for us. So I just wanted to let you know I kind of come from that background. But in terms of the rural transport project, we obviously recognise from engagement with the groups that we work with, so there's NHS partners in there, there's Sestran, who look across the whole of the southeast of Scotland region, that there's a number of issues with rural transportation to healthcare and transport in general, I guess, which I'm sure you're all familiar with. So the distance, the costs, the limited public transport options, dependency on car, and one that's particularly strong in our feelings is this lack of data access. So we're looking to try and effectively integrate different pieces of data together to try and help solve that problem. So the objectives really were to understand, can the data be accessed? So in truth, the level of data that we needed or wanted cannot be accessed. That's primarily a situation we're not being able to get access to NHS service provision data that we would need. Like, it's obviously quite difficult when you can't get access to that data to be able to do some of the work, but you know, we identified that as an ongoing challenge. Can the data provide new insight? Well, there is some new insight created as a result of the project, which I can go on and tell you about. And to try and understand, you know, how rural communities effectively feel in that as well. So a number of kind of challenges that we set out to solve at the beginning of the project. Right, I'm just trying to, yes, I can click on, good. Okay, so one of the key things was obviously to do research with the community and understand exactly what is kind of happening there. So we went out to a number of different research routes, actually, engagement with rural community groups in Fife, and also then engagement with patients that are accessing healthcare. We find some generally quite, I don't know if it's disturbing, but you know, things that you're maybe not expecting to find. But we did receive like regular feedback that patients aren't booking appointments to access healthcare. So we're talking about GPs and also, you know, bigger like appointments at clinics or hospital appointments. People aren't phoning up to book because they face a challenge with getting to these appointments. So that was quite kind of scary in my head. Prescription home delivery dependency seems to exist. It's a good thing in a lot of ways, of course, being able to get those drugs delivered to the home. But there is, I suppose, the risk of a tie-in between, you know, medicating beyond addressing any potential problem. And especially if people aren't booking GP appointments to get things looked at, it can maybe move the problem further down, which is obviously not good. And yeah, maybe more obvious things like special access patients rely on, you know, either drivers or indeed taxi services from the NHS. The NHS spend a significant amount of money on the taxi services that they end up booking and getting people to healthcare for. And then, you know, complex needs of different patients also exist, which again, I think you'd be aware of. Okay, so before I kind of illustrate the proposed solution, or at least part of the proposed solution, Fife itself has some really rural areas in terms of its connectivity, the time it takes, especially using public transport, to get to you know, places where you're accessing services. So again, I think this is probably a situation that you're all aware of from different rural areas, and the dependency on the car. So I'm just trying to think the best way to sort of explain this. I'll just say that, so we did a survey as well. So as well as touching the local resident community groups, we got over 100 responses, and it said, the responses said that nearly 20% of respondents missed a hospital visit. So it's a hospital or a clinician visit, so not just a GP, something that would feel more important than GP, due to transportation issues. And the majority of those were because they didn't believe the transport existed, not that they'd got on transport and suddenly they ended up being late. So they didn't effectively attempt to travel. And just missed the appointment, which is terrible for everyone. Obviously, it costs the NHS money as well. And then in terms of the quality of transport options for access in hospital or clinics, the 57% said it was poor or very poor, and 0% said excellent. So there's kind of, yeah, large challenges there, large challenges indeed. So what we did, maybe it's best if I kind of click on actually and undo that. So the idea was to get access to NHS data for service provision. So the locations, what services are available at those locations and the times that they are working effectively. And then from the transportation side, look at the options for transportation, the travel time for transportation, and to try and link the two together so that effectively hospitals are not booking people into appointments at 9 o'clock in the morning when it's impossible to travel there, or indeed at 4 o'clock in the afternoon where it's impossible to travel home and meet people's requirements. So again, some of the qualitative feedback we got was very strongly pushing for the NHS to have more flexibility in their sort of timings of service provision. And that included more localized service provision in some cases, and also extended opening hours, effectively, as you'd call it, in others, whether it's to do with people's health conditions of getting there, whether it's to do with them having to juggle work and healthcare access, or indeed childcare was another big one. So that was the idea, and effectively we created, I'll skip through the video, we created a solution that looks across 5. So we've got all the travel times in there for public transport, which we get from Google Transit basically, and linking that with other data, and so getting a public transport route. We modeled in demand responsive transport, which in Fife isn't really used for healthcare. We learned that from Fife Council, that said really that's more to do with getting people to shops, and it doesn't necessarily work very well for access to healthcare anyway. For example, even using DRT, you would have to normally use 2 buses to get from locations in Fife to, say, for example, hospital in Dundee at 9 Wells. And even then, you wouldn't actually get to the hospital, you'd just get to Dundee city centre. So we did basically add some modelling in to look at that as well. And obviously the other options in terms of personal car are quite easy to model across the area. So you can see a map of Fife there. Access to 9 Wells Hospital is effectively the darker the colour, the longer the travel time using that particular mode, and obviously that changes as you pick the different modes. So some areas of Fife, even to get to one of the more like closer hospitals, as you would see it as the crow flies, could be 2.5 hours, 3 hours to get there. And that was again echoed through the responses we got. One person saying that they live in a village and they would have to change buses twice, so 3 different buses just to get to a local hospital. It would take them 3 hours to get there, 3 hours to get back, and they can't do it because of childcare, for example. So we built this alongside NHS partners and, as I said, Sestran, and unfortunately, through the engagement with NHS Fife, whilst they recognised like sort of the idea was nice, they thought it could potentially have some use in the future, it didn't really align with any of the way the NHS works, basically, in terms of booking appointments. Priorities in that kind of booking seem to fall more on getting things done. Different departments in the NHS, none of them seem to hold this idea that booking appointments in this way, or enabling booking appointments in this way, was something that they could do right now, effectively. So kind of a disappointing conclusion at this point in time. Obviously, it's something that we're going to keep on pushing, because we think the idea is sound. It's whether we can obviously find, I suppose, a business model for it to work. It would save the NHS time and money. There's no doubt about that. It's obviously would help provide a better service for rural residents as well in terms of access and healthcare. So I think from both sides, from the transportation and from the healthcare, there is a problem. That's pretty clear. And so, but we're kind of at this point now where we've done this research. We've gone through quite a short period of time for the project, 8 months effectively, to get to where we are. 9 months now would be. So obviously you're not going to change a lot, especially in the NHS in that period of time. But it's been good to highlight, I think, the issues. There is a challenge, there is a problem, and it's actually finding the right people to help solve that problem, because it seems to fall within the cracks effectively. So hopefully that's interesting. It's not necessarily as positive as we'd hoped it might be when we started the project. But yeah, it's certainly been interesting. So yeah, I think that's all I really wanted to say, Jenny, to hand back to you.
Cracking, thank you.